Sexually transmitted infections, STIs. It's a crucial part of our health and well-being, and it's time we brought it into the light. The real problem isn't the infections themselves, but the deep-seated stigma that surrounds them. This stigma prevents people from seeking the testing and treatment they need, leading to further spread and potential complications. STIs are simply medical conditions, just like any other health issue that requires attention and care. They are not a reflection of your character, your worth, or your value as a person. Your health status does not define you. They're passed through sexual contact, vaginal, anal, oral, through the exchange of bodily fluids, or even skin-to-skin contact depending on the specific infection. Bacteria, viruses, and parasites are the culprits behind these infections, each with its own unique characteristics and methods of transmission. They move through bodily fluids or direct contact with infected areas, seeking a new host to inhabit. Anyone who is sexually active can get an STI. It's a risk that comes with engaging in sexual activity. Regardless of gender identity, sexual orientation, or age, STIs don't discriminate. You absolutely cannot tell if someone has an STI just by looking at them. Many infections are asymptomatic, meaning they show no outward signs. The risk is a normal part of being sexually intimate, a reality we must acknowledge, and acknowledging that risk helps us focus on real prevention strategies and responsible sexual health practices. The language we use matters. We now say sexually transmitted infection, STI, instead of disease. Why? Because infection is a more accurate and less stigmatizing term. Many people have STIs without ever developing noticeable symptoms or progressing to a full-blown disease state. They can live their lives normally, unaware of the infection. Using infection also helps reduce stigma and reminds us that these conditions are often treatable and sometimes even curable with appropriate medical intervention. So let's get past the judgment, the shame, and the fear, and focus on the facts, the scientific realities of STIs, because knowledge is your best defense against misinformation, fear, and ultimately infection. STIs are incredibly common, and talking about them openly and honestly is a sign of responsibility and maturity, not shame or embarrassment. Understanding how they work, how they're transmitted, and how they can be prevented is the very first step to protecting yourself and your partners from potential harm.